Hello, everyone from Galway, from a very sunny Galway today. Welcome to today's session on MSc Podiatric Medicine. My name is Lucy Heaney. I'm from the International Office here at University of Galway, and I'm joined by Amanda Balch. If you have any questions during the webinar, you're welcome to put them in the live chat on the right-hand side of your screen. I'll let you take it away there, Amanda.
Okay, thank you. Welcome everybody. I'm going to give you an overview of the new programme that the University of Galway and the discipline of podiatric medicine is offering from September. So we're delighted and very excited to offer this new MSc Podiatric Medicine pre-registration or graduate entry programme, as some people may hear them referred to. So I'm going to give you an overview of the programme. I suppose this is a threshold level entry, albeit level 9 and an MSc. It still is a threshold level entry into the profession of podiatric medicine or podiatry. So, for those that may be not familiar with what podiatry is, we are a specialist healthcare profession, and we're dedicated to the assessment, diagnosis, and treatment of conditions that affect the lower limb and foot. So, we are a branch of medicine, and we sit within the College of Medicine, Nursing, and Health Sciences here within the university. So we really deal with a lot of conditions, quality of life of patients, dealing with different pathologies that affect the lower limb and foot. And as podiatrists, we are autonomous practitioners in the fact that we are able to assess, diagnose, and manage lower limb and foot conditions. So the podiatric medicine pre-registration program is really based around our established and undergraduate BSc program. So it's a new program that we designed, and basically this was on the back of the demand for the need for more podiatrists in healthcare and in the workforce. So we designed the program around the 4-year undergraduate BSc program, and we have done a lot of work with regards to mapping it over a two calendar year MSc level 9 graduate entry program. So obviously what we're looking for is applicants and students who have a degree in a cognate area or relevant transferable skills that can come onto the podiatric medicine program. And what we're hoping to do is obviously over a 2 calendar year program, qualify MSc students into the profession and give them the skills and the drive to come into the profession and advance their practice into, having a high level skills in the field of podiatry. So it is a 2 calendar year program. Year 1, obviously 24-25, so it runs from September right through to August 2025, and the second year of the program consecutively over 25-26. So the fees there at the bottom left-hand corner. So EU, we have 12,500, and international is 23,000. So we are very competitive in relation to other programs running and graduate entry level programs with regards to being consistent with that level of course fees. So why podiatric medicine here at the University of Galway? So we are the only podiatric medicine program undergraduates up to now in the Republic of Ireland. So we have an established teaching team, and we have an established clinical facility. So we work very closely with our HSE partners. So we are unique to the University of Galway in the fact that we're the first graduate entry programme and the first graduate entry programme in podiatric medicine to start here. We are renowned in the discipline of podiatric medicine for our international research. We have research assistants, and we have several undergraduate students who have graduated and are staying with us to do PhDs and continue their education in the level of MScs and PhDs. So we have a collaborative research approach, and as we sit within the College of Medicine, Nursing and Health Sciences, we have several opportunities to collaborate with research across the wider college. We're an established and accredited BSc program, and once the MSc program, we will be doing the same and applying for CORU accreditation for the MSc program. So we do have that established teaching team. We have an established program. we have input from disciplines within the College of Medicine across the university. So we have input which really strengthens the programme with regards to having specific discipline input and specific modules from the input of like the likes of anatomy, physiology, microbiology, pharmacology. So we really have a collaborative approach to providing the students with all the education that they require to get the podiatric medicine degree. So as I mentioned, we are embedded within the college, so we have opportunities for interprofessional learning, which is embedded into the undergraduate programme and will be the same for the MSc. So this is where we share learning and share approaches with SIM and also kind of case-based learning with different professionals in occupational therapy, speech and language therapy, social care, medicine, and nursing and midwifery, those types of things. So we do have integration and input from other disciplines, which is again a real strength to the programme and to the established BSc. But obviously the MSc is based around our established, I suppose, expertise in the BSc programme. So we are hoping to improve and provide an excellent programme for the MSc Level 9 graduate entry programme. So what can podiatric medicine offer you? And I suppose as a career, it's a very rewarding career. We as podiatrists, we specialise in the lower limb and foot. But in saying that, the work is very varied. So you can do a lot of different things with podiatry. We work in a multidisciplinary healthcare team. You know, we're offering specialist knowledge around our field of work. We have the ability to assess, diagnose, and manage autonomously patients that come into our care. And obviously, our aim is to improve the quality of life. It's a very practical, hands-on career. So every pair of feet are, they're not the same that come through the door. So it might be manufacturing orthosis, it might be debriding an ulcer, it might be making an offloading device, it might be assessing a patient that has a sports injury, or it might be assessing a 2-year-old that's coming in with tiptoe walking. So the job is very varied with the types of patients that we see and the type of work that we do. It can be challenging, but again, it's very rewarding that we can help our patients to improve mobility or save lives and save limbs with regards to those more high-risk patients with diabetes and vascular complications. So this is just a little bit around the scope of practice of podiatry and what training is, I suppose, encompassed in the MSc programme. So everything that you see on that chart there, apart from the foot and ankle surgery, which is on the far right-hand side, which is a postgrad course, which some students can go on to, and some of our colleagues in the UK, podiatrists, have gone on to be foot and ankle podiatric surgeons. So everything that you see there, apart from the foot and ankle surgery, is part of the MSc programme. So as a student on the MSc graduate entry programme, we train our students across the 2 years to be competent at threshold level entry into the profession in all these different areas. So on the left-hand side, we have the MSK Biomechanics Sports Medicine Podiatric stream. So this is around assessing patients with biomechanical issues, functional problems, injuries with regards to kind of mechanical complaints. So we take the students from year 1 to the end of year 2 in different modules, assessing patients with regards to this element of practice within the profession. The middle strand there is more of the high risk area. So we have patients that are high risk, not necessarily with diabetes. Patients can be high risk for a number of different reasons. They can have rheumatological conditions, they can have vascular complications that present with ulcers and require wound care management. There are the patients with diabetes, and that's one of the areas that's often is associated with podiatry because we are heavily involved in screening patients and as for preventative medicine in the fact that we want to prevent patients from getting ulceration and potentially loss of limb. So a lot of our work, certainly in the public sector, in the HSE and public sectors internationally, is around diabetes care. Vascular is an element of that, so we train our students in vascular assessment to a high level with regards to being able to manage those patients and linking with our colleagues in vascular, in endocrinology, so they get that holistic care that they require. On the right-hand side there is minor surgery. So we teach our students the concepts and practical skills around local anaesthetic. So that's hence why we have our involvement from the pharmacology discipline. So there's training around the pharmacological aspects of injection therapies, local anaesthetic, and toenail removal, partial and total nail avulsion. So that's the minor surgery aspect that is included into the training of the MSc programme. So we do work in a variety of different environments, whether it's in the public, in a hospital setting, whether it's in the community. Some of our some podiatrists work in orthotics companies manufacturing orthoses, assessing patients. Some podiatrists work in sports settings with sports clubs, Olympic medical teams. So it's very varied with regards to the settings that we work in, and we work alongside different health professionals, whether that's consultants, so orthopedic consultants, pediatric consultants, GPs, nurses, physiotherapists, orthotists, and obviously there's a research side as well. So some podiatrists go into practice, others stay on and do research and go into kind of education or go on to do PhDs and higher level training in that respect. So what's the curriculum like? So I'm going to give you an overview of the curriculum. So if you're interested in applying or have applied, then you have an idea of what you're coming into. So this is the year one modules. So we have a suite of modules that take students through the different elements of the core knowledge and skills competencies that are required at threshold level entry into the profession. Upon graduation. So the year one of the programme really takes students through the groundings of the knowledge around podiatric pathologies. So certainly in the integumentary system module, the one at the bottom there, it takes you through kind of skin and nail pathologies that you would come across, as well as looking at starting to look at wound care and practice around the higher level or the more complex patients that we would see. So it's really around kind of the groundings and the assessments of our patients. So very early on, we would get students to be patient-centred. So there is a clinical element, obviously, that is embedded into the programme. So the modules run throughout the week, and in amongst the lectures associated with theoretical modules, there will be clinical rotations. So at our clinical facility at Merlin Park Hospital, we will have students, our MSc students, up on clinic treating patients once the groundings have been achieved with regards to the preclinical skills and the knowledge base in semester one. We'll get students up on clinic treating patients, and there will be a block in semester three, which I'll explain in a second. So these are the suite of modules. So there are the added strength to the program is that we have anatomy, which is the human body structure module, and we have a dedicated gross anatomy of the lower limb module that is designed specifically for the podiatric medicine program. We have physiology inputting, so we have human body function and then applied physiology. So all the elements that are required for the groundings of clinical practice. We also teach students in this first year of the programme with regards to neurological, vascular and musculoskeletal assessments. So we take students through the clinical competencies of how to assess patients with regards to those specific skills. So this is how year one of the programme looks structurally. So some modules run over semester one only, and some modules run over semester one and two. The only module that runs over the 3 semesters, because it's a calendar year programme, the podiatric medicine practice one is the clinical module. So that's where all the clinical skills, the clinical training, and the time on clinic with patients that's associated with this module. So it's it's the largest module in across the 2 years of the programme. So in semester one and semester two in podiatric medicine practice one, it's around the knowledge and skills, the grounding to be able to then go up onto clinic, and the third semester will be primarily a block placement in our clinical facility to get the clinical hours. Over the 2 years of the programme, students have to complete 1,000 clinical hours, so we have to build in and factor in time on clinic to be able to accrue those hours. Professional practice and healthcare leadership practice one runs over 2 semesters. human body structure and human body function, which is anatomy and physiology module. They run in semester 1, and then we pick up gross anatomy of the lower limb in semester 2 as an advancement from the human body structure module. The applied physiology module runs over 2 semesters, as does human motion and biomechanics and the integumentary system. So covering all the knowledge and skills with regards to different conditions and skills required to assess patients at relevant to the year 1 of the study of the MSc programme. This is what year 2 of the programme looks like. So we advance, and the complexity of the patients that our students see in the second year of the programme increases. So year 1 is around kind of developing the basic skills, but then the assessment of patients in relation to neurological, vascular and MSK training. Year 2 of the programme is around kind of clinical rotations. So there's pediatric rotations, there's MSK rotations, there is vascular diabetes rotations. So the complexity of the patients that are seen in the Podiatric Medicine Practice 2 module increases, so that you get experience, and they're able to consolidate knowledge from the theory modules that you've learnt in year 1 of the programme, but also alongside the modules in year 2 of the programme, the likes of pharmacology. So that's in year 2 when you do your injection therapy training. And musculoskeletal medicine across the lifespan, there's a sports MSK element in there and a pediatric element. And in the professional practice healthcare leadership practice 2 module, there's elements around working with vulnerable adults and skills for practice. So thinking about work either in private practice or in the public sector. So we prepare students with regards to different work settings that they may want to go in once they graduate. There is a research element to it, so there is a research dissertation which you plan for at the end of year 1, and complete that in the second year of the programme. So the clinical placements, as I mentioned, we have students have to complete, and this is a professional body and an accreditation requirement that all students undertake 1,000 clinical hours over the 2 years of the programme. So we do have a dedicated 20 plus chair clinic, dedicated clinical facility at Merlin Park Hospital, which is just across the city in Galway. So the bottom picture there is the clinical facility, and the unit in the middle is our podiatry unit. So we have a surgical suite that was built on a good few years ago. So we have a surgical unit on the facility and a 20 plus chair clinic. So we have the capacity to be able to provide 100% of the clinical training for our MSc students at that facility. And we have a team of academic staff and clinical HSE clinical staff that help to complement the learning and the teaching in that clinical facility for our students across the programme. It's a community clinic, so the variety of patients are there. So we have different clinics that run that students rotate through, as I mentioned previously, and we have kind of day placements that students are opted into with regards to kind of visiting and shadowing orthopedics, diabetes, and voluntary sector. So this is just a few pictures of our clinical facility. So it is a fabulous facility, and I suppose one of the unique selling points to the programme here in Galway, and the fact that we have this dedicated facility, and students absolutely love to be on clinic. They gain so much from the academic and clinical team being supervised on clinic and the types of patients that they see. So they get obviously real life exposure to a clinical facility that is treating patients in the community. Top left hand picture there is our surgical suite, and we have a biomechanics kind of area lab. We have equipment that we use for biomechanical assessment, and as I mentioned, students really kind of thrive to be on clinic and love the experience that they're provided with to gain that clinical learning in that environment. So this was an audit that we did a few years back now, but I suppose just to provide you a little bit of information with regards to opportunities after graduation. A lot of this is obviously based on our BSc program, because obviously the MSc is new to us this year. But based on the BSc and audit of our BSc graduates, they go into various different work settings, and there's real kind of scope for students or graduates to go work overseas. which a lot of our graduates have. A lot of our graduates have gone into posts in the HSE and now are working nationally within Ireland in the HSE setting. Some of them may have gone into kind of private companies, so into private practice, either setting up on their own or going into a private practice with an established practice as an employee. There's footwear companies that are employing podiatrists, orthotics companies, sports clubs. Some have gone into education, as I mentioned. We have graduates that we retain and they stay on to do PhDs and postgraduate study, research, or are collaborating with regards to working abroad. So there's a lot of opportunities with regards to getting into the profession and qualifying as podiatrists. And it's a really exciting time for podiatrists with regards to job opportunities at the moment in Ireland, but also internationally. So what are the course entry requirements? So obviously we're looking for an equivalent to a University of Galway minimum 2-1 degree in a cognate discipline. So we've at the bottom there we've put an idea of what we kind of determine a cognate degree, but it's not certainly an end list or defined list. We are appreciative of the fact that mature students and students that have degrees have transferable skills. So we have a two-tier screening process in place with regards to applications, and we are inviting applicants into interview just to explore that with regards to transferable skills. If the degree isn't in a direct cognate area to kind of like biology or physiology or anatomy, those types of things. So we do appreciate that applicants will come in with different strengths and different skills, and hence why we are interviewing candidates just to explore that a little bit more and the drive and engagement with regards to studying podiatric medicine. So we do require English language for any international students, so that's outlined on the left there on the screen. That is a requirement that we have, and obviously there are certain requirements that applicants come onto the programme with regards to GARDA clearance and vaccinations, and that's standard for all health programmes within the University of Galway. The application process, as I mentioned, is a two-tier application. So our application portal is open, and you'll find that on the MSc webpage. So once you apply, you're just asked to provide some documentation, which is listed on the left-hand side there. So qualifications, if it's applicable, English language competency, a personal statement as to why you want to come onto the programme, identification, your current CV, and 2 written references. Ideally we'd like 1 professional and 1 academic, but if you don't have an academic, then 2 professional references are absolutely fine. Once we get the applications in from the CRM recruit, we look at those and we invite candidates for interview, and then we just explore kind of skills and transferable skills and knowledge from your previous roles and I suppose appropriateness onto the programme, and then an outcome will be made following that. So why Galway? I suppose I've explained and talked to you about the program and the strengths of the program and why we're so excited to bring you this new program to the University of Galway. But Galway is an amazing city. There's a great vibe all year round. There's always something going on. It's called the City of Tribes, and we're uniquely located on the Wild Atlantic Way. So we have a thrive of tourists coming all year round into the city, which brings a really good kind of atmosphere to the city and surrounding areas. So we're based on the kind of coastline, so it's a beautiful area of the west of Ireland, and it's kind of, I suppose, we call it a city, but it's not a large city that you can't get around easy. So that's one thing that I loved about when I moved to Galway, is the fact that it doesn't feel like you're in a city. It's small enough. It's, everyone is very friendly, and it's a very kind of scenic and beautiful city to be around. And the university sits within the heart of the city, so you're in walking distance from the university right into the cathedral, which you can see in that picture there in the middle. And you're right in the middle of the city with regards to kind of being able to access everything and be in the middle of all the action that happens throughout the year. So if you wanted to find out more, there is a course page link there, and we have the web page up and running, which gives all the outline of the programme and obviously the application process and application link. We do have an email, so if you do want to email us any specific questions, that's the generic pre-reg program university the email address. Obviously, myself, Amanda Walsh, and our administrator Fiona Lowry are open to kind of any queries or questions if you had anything. And I'm happy to take questions and answer anything today, but also if you think of anything afterwards, you can email us.
That's great. Thank you, Amanda. I see if you stop sharing there, Amanda, you can see it. See Rachel.
Yeah, just one second. There we go. Okay, I can see the questions now. Okay. Okay. Yes, so obviously this is threshold level entry, the same as our BSc program. So ultimately, albeit it's a level 9, an MSc, once you qualify at the end of the MSc after the 2 calendar years, we have to start the program to then get validated by CORU. So we are starting that process. So yes, at the end of it, you will be, once you've qualified from the program, you will be able to apply for CORU registration. A lot of our students then obviously apply for HCPC in the UK as well. So the program is developed and obviously based around our BSc program, which is accredited and validated. So the same would apply once we go through that process to the MSc program. So yes, upon graduation, you'll be able to apply for CORU registration and HCPC registration as a podiatrist in that profession. So also for applicants who are invited to interview, will those be held in person? We can do either. I mean, we are preferring in person just so that we can meet people. But if it's not possible for you to come to Galway, we're happy to offer an online meeting. So we're very flexible with regards to people's kind of availability and accessibility. So we're happy to do either, dependent on people's preference.
That's great. Thank you. Thank you, Rachel, for that question. Anybody else watching? We can wait a few more moments if you want to ask any more questions. Also, if you're watching the recording, obviously Amanda has given you contact details there if you have specific questions for the program or if you have general questions for the university or about life in Galway, you can ask them on this platform here. We have ambassadors who are willing to answer any questions you might have as well. I think that might be it. I think that's all the questions we might have. Thank you so much, Amanda. Thank you, Rachel, for your question.
Thank you, Rachel, for logging on. Thank you.
And thanks, everybody, for watching. Take care.